Good evening, and thank you for joining The Breakdown with me, Toni Waterman. Here are the big topics we'll explore tonight. An aging population and fewer births, it's a double whammy for the economy. We'll take a look at where it leaves healthcare, pensions, and innovation. Preying on the elderly, a look at financial abuse in Bermuda. And the future of tourism is here, a look at what's in store for the next 6 years. Well, we have a jam-packed show for you tonight, but first I want to start off by talking about developed nations, because despite all their differences, many of them are grappling with one epic issue: aging populations. People are living longer and reproducing less, and that has introduced a very interesting economic dynamic that we're going to delve into in just a minute here. But first, Gary Foster Skelton took to the streets of Hamilton for your take.
Are you taking care of an elderly person at this time?
Yes, I am taking care of an elderly person. My mom, actually.
My mother, who's elderly and requires a certain degree of care.
My parents are taking care of my grandma.
Our mom lives with us, me and my sister.
My mom takes care of my grandmother and my aunt.
We took care of our mother till she passed, yes.
And what kind of costs were involved in that?
The costs of elder care, and if you don't have a support network, there are 5 of us, so it was a lot easier.
Substantial costs, everything from health insurance to ongoing daily care.
We've had people in my family that have required residential and also in-home care with caregivers coming into the home, and it is very expensive.
The little insurance that we do purchase does not cover much of anything.
It's a lot of work, and it could be taxing, but we are grateful that she's still here with us.
Have you made any preparation for your later years?
I constantly think about it. I know I need to.
Trying to. I would like to think I am.
I'm sort of prepping for it, trying to save as much as you can.
I'd have to say no.
I don't know. I haven't thought about it. Probably most people don't think about that.
I wouldn't say I'm half as prepared as I need to be.
I do think about my future and when I get there, but hopefully in the next couple of years I start planning a bit better.
All right, some of those people need to jump on that preparation bandwagon, but now it's time to break down Bermuda's aging population. So over the last 50 years, the elderly population, that is that 65 plus age group, it has grown faster than the overall population. So this is the 2010 versus the 2016 census. And what you can see over this 6-year period is that in these younger age groups, we've seen some shrinking here as a total percentage of the population, but we were seeing growth in the 45 to 64 in the 65 plus age group. So in 2010, that's the blue line right here, 14% of Bermuda's population was 65 or older. In 2016, that had jumped up to 17%. And this push towards an older population is only set to intensify. So come 2026, the Department of Statistics is expecting us to see a further shrinkage in that younger population. There wasn't comparable data for these two age groups right here, so I left them out. But this is what's really interesting. Take a look at this 65 plus age group. We go from 17% in 2016 to an expected 25% in 2026. So 1 in 4 individuals will be 65 or older. That's the expectation come 2026. And there really are just 2 factors at play here: fertility rates and life expectancy. So let's start off with those fertility rates. So in 1950, there were just over 30 live births for every 1,000 people. And take a look here. Back in 2016, it had dropped below 10. And you can see that from the 1970s about right here, births have been below what's known as the replacement level. This is the number of births you need to maintain the current size of your population. Let's take a look at that life expectancy. So back in 1960, the average woman could expect to live to 65 years old. She is now pushing 85. And it is a similar story when you take a look at the men, although they don't tend to live quite as long as women do. So you have fewer young people, more old people. That is going to shift the old age dependency ratio. Now, don't get scared off by that term. That is just the ratio of seniors to working age population. So back in 2010, there were 19 seniors in Bermuda for every 100 workers. In 2026, it's expected to jump up to 40 for every 100 workers. So why is this important? Well, workers tend to spend more money, they pay more taxes, they feed into pensions, and they help keep those healthcare costs under control. And retirees, they tend to do the exact opposite. Now, we also know that as people get older, they tend to need more health care. And I don't think there's a better representation of that here in Bermuda than this chart right here. This is the per capita claims cost. And you can see that when Bermudians are in their 20s, 30s, 40s, and 50s, they're kind of humming along right here in this lower end of the range. But once they hit this 60 mark, it really spikes up higher and it triples over about a 20-year period. So you can see what kind of strains that can put on an economy. All right, we've broken this down now. So now we need to talk economics and we need to start talking about solutions. And I have two fantastic guests with us tonight to help us do that. Dr. Claudette Fleming, she is the executive director at Age Concern, and also Ricky Brathwaite, health economist at Bermuda Health Council. Thank you both for joining us this evening.
Thank you for having us.
Dr. Fleming, I want to start off with you because those graphs, they represent a very clinical approach to this issue. How are you seeing it manifest in real life?
Well, I think families are shrinking, and we've been noticing that for a very long time. So perhaps our parents and grandparents came out of families that had 5, 7, 8 kids. And in our lifetime, we're having 2, 3, maybe none. And so practically speaking, the family has already begun the transition that the numbers are showing at the broader systemic level.
So Ricky, when we look at economies and the health economy, is this aging population phenomenon that we're seeing across the world, is this the biggest issue facing economies right now when it comes to the health dynamic?
It is a huge issue. I mean, the good thing is people are living longer. So that's a wonderful thing. The outside of that is that as you live longer, you have this thing called negative savings. You retire and you start to spend down on what you have instead of building into the savings accounts that you have. And what that leads to is this whole cycle from an economic standpoint of reductions in efficiencies, reductions in innovation in the society. And on top of that, we have a health care issue where we have a lot of burden of disease, which is costly.
I mean, are there innovative ways that it can be tackled at this point, of solutions that are very innovative been developed?
So it can't just be about healthcare in the traditional sense. It can't just be about hospital care or providers. It also has to be about looking at the environment that we have or we're living in. So we have to look at housing. We have to look at places, safe places to exercise, look at inactivity and diet. So those are the things that we're all looking at, and we have to do it collaboratively.
In a lot of ways, we're living in the age of consumer empowerment. Mm-hmm. But when you look at the costs here in the Bermuda, as a consumer, you can feel very disempowered. Mm-hmm. But is that really the case?
I think the status quo has been that the healthcare industry is responsible for our own aging success, and there has to be a shift in that. I don't know that we have recognized as an aging population the power of our dollar. There's numbers that you showed in terms of healthcare cost. And the amount of dollars that are going in not just mean that we have illness to deal with, but it means that we have consumer power within those numbers, and that can be actually used to turn the situation around. When you spoke of innovation, it's not so much that we need creative ways. I think we have to come to terms with the reality of what we're facing and use the tools that we have in order to change the situation. So, for example, wellness, and it doesn't cost us any extra money to put our emphasis on the wellness end as opposed to the medical end, and that's a place that we can start.
So, how much could the wellness feed into bringing down overall costs?
So right now we're spending about 97.5% of our healthcare dollars on treatment. So the wellness has a very small part of it. If you look at Center of Disease Control and Prevention numbers, they says by doing 3 things: by being more active, having a better diet, and not smoking, you can reduce things like diabetes by 80%, you reduce heart disease and strokes by 80%, and cancers by 40%. And right now we have approximately 8,500 people who are diabetic based on the STEP survey, 13%. Think about reducing that by 80% as you age. That's 6,500 people that wouldn't have to deal with diabetes as they age. Mm-hmm. Aging is not a trigger for a disease. You can be healthy as you age, and that's something that we have to put more focus on.
That sounds really good in theory, but convincing people to change their habits is a whole other issue. You have a population here where 75% are either overweight or obese. I mean, how do you go about changing the habits? How do you incentivize people to want to get well so that we can bring down these healthcare costs?
So there's this concept called choice architecture. You create an environment by which you nudge people in the right direction. You pull things off the shelf that you know is harmful. You create open spaces and community events for people to get together and become more active. And it's not about forcing people into outcomes, but it's about nudging them in the right direction that you know will be better for population health and the culture. So we can't wait till we're 65 to start on this whole thing of transformation and empowerment. You have to start when they're 2 years old, 3 years old.
Okay, so that's really good that you brought that up, because
Yes.
what we saw when Gary went out on the street and talked to people, when he asked them, well, are you guys preparing for yourselves? You're taking care of your elderly, parents and relatives. Are you preparing for yourself? How does that compound the problem going forward, where you have not only this aging population, but also a lot of people who are just not prepared?
Well, the older person is always somebody else. It's those people over there. And the thing about aging is that it catches up with you very, very quickly. But I think one of the things that you observed in your observations is that we have this sandwich generation. And although they may not be experiencing the aging issue themselves, they are seeing their parents go through it. And so in many ways, we get people's attention by having them directly impacted by it. We need to do a better job, if you don't have any older people in your life, of letting the public know of exactly how the aging population is hitting them where they are. The cost of our healthcare, as an example, the ability for our country to produce, and so on and so forth. We have to make those numbers real for the younger worker that's coming in. And I think when we start to do those things, we'll start to see a shift in our attitudes.
I mean, I guess the good news here in some way is that Bermuda's not alone when it comes to this, and also not necessarily in the worst case scenario. So you look at Japan, which has the oldest population in the world. We talked about that old age dependency ratio. It's already at 46 today. Right. It's at 46. And Germany is at 36, and France is at 32. We haven't seen these economies fall off cliffs. So is there something that we can glean from what they're doing for Bermuda?
Well, there is a different scenario. I mean, these are populations that are much larger. We are impacted by the global economy in a way that's different than a lot of these industries or economies that have their own industries and own manufacturing and so forth. So we have to be very careful to create programs. We have an opportunity to change because we have so few people in terms of our population. So we should take the lessons learned from places that have already gone through some of this aging.
Just very quickly here, I want to ask you both, because there was always this debate about what should be public and what should be private when it comes to the healthcare system. Are there specific things, specifically because we're entering in to this very graying society, that there should be a shift taking place?
I believe so. I don't know that everyone will agree, but I think access to health care at the very youngest of ages, irrespective of your ability to pay, is important in the aging process. And that's going to stop people from being left behind, which is probably what is happening right now.
Ricky?
And I think the government has to ensure access to wellness. So we talk about healthcare, but access to wellness is across the board, the whole spectrum. Private industry has a great role to play in terms of innovation and ensuring that the tools that are used within the healthcare system are up to date.
All right, thank you both very much for joining us, Ricky Brathwaite and Dr. Claudette Fleming. Very interesting conversation. All right, time now for a quick break, but when we get back, we are going to take a look at the darker side of aging, financial elder abuse. It's often called the crime of the 21st century. That story next.
New Toyota Rush, Bermuda's biggest SUV with 7 seats. There's always plenty of room. Available at Bermuda Motors.
Good local food, local cooking techniques, family tradition recipes.
What I found is a lot of people are looking for more gluten-free stuff as well.
We like to use obviously local product.
Some fresh Bermuda fish, silk snapper and turbot. I found out it's better to go catch my own.
Everything we make is homemade. I love making people happy with a tasty treat. From happy beginnings and life choices that we make along the way,
Colonial protects your lifestyle with the best insurance cover at the best possible price.
health insurance with far-reaching benefits,
Family protection and long-term financial plans.
business insurance, and generous employee benefits.
For happy beginnings to happy ever after, visit cgigroup.com.
Colonial, where people come first.
Welcome back to The Breakdown. Tonight, we are talking about the impact an aging population is having on Bermuda's economy. But there is a darker side, a much darker side of aging. Elder financial abuse. It's massively underreported and so widespread that it's often called the crime of the 21st century. According to the National Adult Protective Services Association in the United States, 1 in 9 seniors reported being abused, neglected, or exploited within the last year, and 1 in 20 seniors indicated some form of perceived financial mistreatment. Joining me on set now to discuss the issue is Jane Collis. She is a senior associate at MJM here in Bermuda, and she is an advocate for the legal protection of seniors. And in 2014, she formed a law reform committee to focus on senior issues. Jane, thank you so much for joining us this evening. I mean, those statistics out of the United States are staggering. I reached out to the Aging and Disability Services Department. 2016 to 2017, there were 28 investigations into elder abuse. It wasn't divided out into financial abuse or physical abuse or exploitation in some other way. I know that you've worked on cases like this before. Is there any indication of how widespread this is here in Bermuda?
Unfortunately, it's hard to get statistics on this, and Aging and Disability Services is certainly the best source of that, partly because it's a very private matter. Often there's litigation involved. Often people are afraid to discuss it because it's like airing their dirty laundry in public. And a lot of times people are just afraid to report it. They don't really know where they should go. They fear being alienated from their family, who very often are the people who are abusing them. They fear being threatened with being put in a home somewhere. And so they're disinclined to talk about it.
There was this case this summer of this American life coach, which had gone to court. $56,000 she allegedly took from an elderly Bermudian. It was thrown out on a technical issue.
I know.
I mean, but is that where the abuse mostly comes from?
My experience is that the family is the hotbed mess for abuse of all different kinds, and they tend to come together. Financial abuse may be where it starts. If there's any kind of pushback from the elder, then it may become physically abusive.
What does it look like? What form is it taking, the financial abuse?
It takes a number of forms. Enduring powers of attorney are powers of attorney that come into effect when somebody has lost capacity. In those instances, the victim of the abuse may never know that they've had their accounts emptied or property transferred or anything of that sort. Often it starts with things like voluntary conveyances of property. So a senior is encouraged by family members to pass the property along to their kids. And once they do that, of course, they've lost any kind of ownership and control of the property. So what the kid does with the property is entirely up to them. And you see situations where seniors are being stuck in a back room somewhere. You know, they're not free to live in their home. Joint ownership of bank accounts is another problem area. Again, for convenience purposes, a senior citizen may ask kids to join them on bank accounts. It's strictly intended as a matter of convenience, but joint ownership means joint ownership. So once another person's name's on the account, they're free to help themselves.
Senior Magistrate Juan Wolf a couple weeks ago came out and said that he's seen an uptick in the number of older people in court because they can't pay their debt. They're drowning in debt. Is there a connection here between elder financial abuse and the number of elderly people that are showing up in court that just can't service their debt?
I think that's very often the case. And what happens is, you know, you have parents who want to be generous to their kids. They want to help them. They are assisting them with loans. They are sometimes guaranteeing those debts. And then there's default on the part of the kids. It may be the parents' property that has secured that debt. And they find themselves drawn into something where, you know, they should be completely independent of that, but they're drowning because they've been trying to help.
There is the Senior Abuse Register Act of 2008. Does that go far enough to protect seniors?
No, unfortunately, I mean, it's a starting point, but it was really designed more to deal with abuse in care and there is an offense for financial misappropriation. But unfortunately, that is really looking to establish theft, fraud, something where there is a criminal standard to be applied, so it's beyond reasonable doubt. It's not an offense that's easily proved.
How big of a problem do you see this becoming as Bermuda pushes towards 25% of the population being 65 and older in less than a decade?
I think it's going to be a huge problem. We are struggling. Our economy is struggling. A lot of these seniors, they have relied on rental income to supplement the pension, and they're not getting that rental income because it's just the renters aren't there anymore. And their kids are struggling. A lot of them have spent beyond their means and look to the parent to help them out. They're going to inherit it one day. Let me have it now. So I think that's going to be a big problem.
Where can people, if they feel they're in this type of situation, where can they turn for help?
Well, the Aging and Disability Services does have the ability to carry out investigations. There are issues with that, and but it is a place to go. I also just encourage people to reach out to lawyers. I know that there's a fear about spending money. A lot of us do a lot of things for, free. And in cases where it's an emergency, you got to get help somewhere.
All right, thank you very much. It's a very concerning issue to think that seniors are being taken advantage like that. Thank you very much, Jane Collis there from MJM. All right, time now for a quick break, but when we get back, we're going to take a closer look at the new National Tourism Plan. It sets the course for the sector over the next 6 years. I'll have a sit down with BTA Chief Kevin Dallas to see what it all means for the economy. Stay with us.
Win a trip or two to the 2019 Trinidad Carnival. When you purchase a car from Bermuda Motors, your name will be entered into a draw for a chance to win an all-expenses-paid trip for two, including flights, accommodation, and tickets to the Trinidad Carnival. Visit Bermuda Motors on Church Street or bermudamotors.bm.
Good local food, local cooking techniques, family tradition recipes.
What I found is a lot of people are looking for more gluten-free stuff as well.
We like to use obviously local products.
Some fresh Bermuda fish, silk snapper and turbot. And I found out it's better to go catch my own.
Everything we make is homemade. I love making people happy with a tasty treat.
Ever wondered what smart health insurance feels like?
Colonial's 24/7 worldwide health insurance does most of the thinking for you.
1,500 CGI health claims are settled daily.
60% of claims settled automatically.
You can access your health plan almost anywhere, anytime.
And have smart wellness with online data tracking.
And more provider choices for you and the people who matter most.
Premier Health is smart health insurance, and it feels good.
Colonial, where people come first.
Welcome back to the program. Well, it took the better part of a year to create, and it's meant to plot out Bermuda's tourism future until 2025. We are talking about the newly released National Tourism Plan. It aims to create a more balanced approach to the tourism sector, and it calls for change. Change in the way Bermuda thinks about the industry, a change in infrastructure, and a change when it comes to thinking green. In this week's Bright Ideas segment, I sit down with Bermuda Tourism Authority CEO Kevin Dallas, and I started off by asking him if the record numbers the tourism sector has seen is sustainable.
The sustainability of growth in tourism is one of the issues that the National Tourism Plan addresses. So we anticipate that over the next 6 years, so taking us from 2019 to 2025, the tourism economy can grow from a little over $800 million today to $1.2 billion. One of the ways in which we want that economy to grow is by being greener. In order to be sustainable, one of the things that we need to do is to address the seasonality of tourism. We've recognized that rather than ending seasonality, what Bermuda needs to do is embrace seasonality as we become a year-round destination. So each of Bermuda's seasons have distinct strengths and reasons why thinking from a visitor perspective, they should visit Bermuda and can have a really unique and special experience. And what we need to do is draw out and develop those benefits and make them clear to our visitors. And that's a huge opportunity for growth. Bermuda is near its full capacity when we look at the June, July, and August summer months. In particular, Bermuda doesn't need more cruise visitors in those months. But where we see real opportunity is in the spring, fall, and winter, where using the infrastructure that we have, Bermuda can serve many more visitors.
I want to talk to you about the cruise arrivals because in the plan it says that one thing that you guys won't do is give cruise partners preferred access to the docks if they don't commit to using it in the off-summer months. Are you afraid that you can alienate some of these partners and they'll just pull out of the market completely?
So Bermuda's cruise partners are incredibly important to us, and they're an important part of our tourism economy. What we've realized is that there is enormous demand from our cruise partners and from the cruise lines that are not today our cruise partners for the dockyard berths for large ships in summer months. So what we've realized is that as part of the trade-off for getting access to those docks, we would like our cruise partners to do more in committing to coming to Bermuda in April and in October and November, as they have started to do more of this year. And we would like them to commit small ships for Hamilton and St. George. And when we think about that as a bundled proposition of what a cruise line can bring in value to Bermuda, we don't think that that is an unreasonable ask.
There is a piece in the plan that says the transportation needs to be more visitor friendly. What specifically do you mean by that?
So when we talk about being more visitor friendly and when we talk about infrastructure in tourism, what we are really talking about is the need to create a frictionless experience for our visitors. So visitor expectations have changed. So while once upon a time people were happy to queue in a taxi line and perhaps grateful that there was a taxi at all, today's visitor expects to be able to push a button on an app and have a vehicle drive up and pick them up. That does not mean that Bermuda necessarily needs Uber as a solution, but it does mean we need to think about how Bermuda can, at all stages, not just in transport, but from the visitor arrival to how they get through the airport to how they get from the airport to their hotel. We need to think about all those touch points where, thinking from a visitor perspective, we can make that transaction easier and more frictionless for the visitor.
Does there need to be more of a car rental system?
Well, we certainly need to think through how those families are going to get around the island and how we make that easy for them. The active family segment is actually one of the 4 visitor segments that we've prioritized. Right. It's the one where Bermuda is least ready in terms of the product and experience we offer to meet their expectations today. The addition of mini cars to Bermuda's transport fleet has been a huge benefit for our visitors and one that's gotten rave reviews. But those are 2-seater vehicles. A Twizy doesn't really help a family of 4 get around the island. So today they are dependent upon our taxis and our buses and our ferries, and we don't think any of those experiences today are as frictionless as they could be.
I mean, what would be a more reasonable solution?
I mean, for example, ride sharing and ride hailing, which doesn't have to be Uber, right? But
meaning that it could use the existing taxis.
Or more taxis plus a licensed minicab fleet. We have gypsy cabs today. What if we normalized and legalized that and actually put them on some sort of ride-hailing scheme? If visitors could come out of their hotel and be guaranteed to be able to get somewhere, that would be transformational.
That's going to do it for tonight's breakdown. Thank you very much for joining me. If you missed part of the show, if you just want to watch it again, it does rebroadcast on Sunday mornings at 9 a.m. on ZBM TV 9. You can also find it on our Bermuda Broadcasting YouTube page. I'd love to hear from you, as always, the good and the bad. I got thick skin, I can take it. You can send me an email, and you can always find me on Twitter. My handle is Toni Waterman _. I hope you'll join me next week for another breakdown. Until then, take care.